Hello and welcome to One-on-One on Plus TV Africa. I am Elsie Godwin. On this episode, we are one-on-one with a healthcare management consultant, the project director of Go Pink Nigeria, founder of Wish for Africa Foundation, and the founder and medical director at Optimal Cancer Foundation, Dr. Femi Olaleye. Thank you for your time, Dr. Olaleye.
Thank you. Thank you for having me.
All right. So what led to you being a physician? Was this the plan from the get-go?
Well, the best way to answer that, yes, must be, because I'm living it. But as far back as I can remember, I've always wanted to be a doctor, such that, even my mom was nicknamed Mama Doctor many years before I graduated.
Before you
as a
became
doctor.
one.
Yeah. But the touching reason and the most inspiring reason I think I could find would be the fact that as a young boy growing up in Lagos, I could see around me evidence of violence. And at times when people have accidents, domestic accidents or stuff like that, I'm always moved to want to do something. And to a point where when animals around me are injured, I'm always trying to fix them and stuff like that. And I took a natural liking to science courses when we were in secondary school, to a point that I went to a local school that didn't have opportunity for me to do sciences. And my dad more or less had to equip the laboratory so I could do science studies there. And I incidentally passed out as one of the best students of that school and became a doctor from there. So I've always wanted to be a doctor.
Okay, good to know it's been a passion from day one.
Yeah.
All right, you spent a decade of service in British National Healthcare System before returning home. Now, what prompted the decision to return home and what has your experience been?
When I've been asked this question, what prompted? I never actually left for England with the mindset of not coming back. So, so I've always believed that I was coming back. I graduated in Nigeria as a doctor. I went to one of the best universities in the world, Femi Olaleye University. We call it Great Ife. And so my mindset from day one was I will always practice in Nigeria. However, I recognized I needed to broaden my views, broaden my perspective, and I particularly wanted to be a different kind of doctor. So I needed to go abroad to go do some postgraduate qualifications in obstetrics and gynecology, and I had the opportunity to do that in the British NHS in England. So, like most people who checked out then, the usual thing is, oh, you forget about that. You look for ways to make your life comfortable and you enjoy your life. But I felt there was a need for me to come back. Nigeria trained me as a doctor primarily, free of charge. And I'm a Nigerian, so when I'm walking the corridors of the NHS hospital and I'm seeing white patients, Caucasian patients, the first thing they will see is my color. No matter whether I've changed my name to Frank or I carry a different passport, now a red passport instead of a green passport. It's Nigeria that's in me. It's Nigerian values that brought me up to that point. So I've always wanted to connect back to Nigeria. And I thought that the most important reason is my skill sets are needed here. And the skill set I'm talking about is not just a doctor. It's somebody like me who can understand the issues of healthcare delivery and find solutions to them. Finding those solutions is not what you're taught in medical school. I've gone to acquire those extra qualifications from a business management school. So I went to Imperial College while I was in London, knowing that I'm going to come back to Nigeria to solve problems. So I need to be extra equipped with skill sets that will allow me to deal with those problems. And I'm very grateful to God that I'm here now doing exactly what I believed I should be doing. So those three reasons probably informed my desire to come back and go through the challenges.
So what has the experience been, talking about the challenges?
The challenges are there for everybody to see. We're a developing country. A developing country meaning that we don't have the infrastructure that we need to succeed. And that's how we have been described, developing. So we're developing to what? It's always a joke from a developmental mindset. What are you developing into? How long is your target of development? Because we're a developing country, the infrastructural challenges are there. So I won't waste our time talking about infrastructural challenges. The biggest challenge we've had is that of ignorance. How people are ignorant about so many things, such that even the educated ones we've all become so immune to the abnormalities around us. One, because of one, we don't know better, so we're blissfully ignoring things, which has its own multiplier effect. For example, if you know something, you have knowledge about something, then you can take action and courses of action or series of actions to prevent that thing from happening. So because of ignorance, then you don't have the multiplier effect of poverty. So if people you're delivering care for as a doctor are ignorant of what you are about to do for them to help them, then they are poor. They can't afford your services. And the third and the most important reason is because of that ignorance and the poverty of mindset, the crop of leaders we get are from the same pool of people that are ignorant and poor. So you have ignorant and poor, and that poor is not their pocket. Poverty of mind in leadership. So when I'm talking to in quotes, for example, a member of the House of Representatives or a senator or a governor about health solutions, he's lost because he has come from a crop of people or a group of politicians, and not all of them are all that terrible, that are ignorant. The only thing they've spent their time, their adult life doing is how to get to political office. So they've been parochial in their mindset. So people who win elections in Nigeria are very good at winning elections, but are very poor at solving Nigeria's problems. So those are the challenges.
Let's take it away from the ignorant ones and all that. You have lived outside and practiced your field outside the country. It's easy for us to sit down and say we want to be like the UK, the US, or Canada and the likes, right? But you have lived it and you're back here and you've also experienced what is going on here. How would you say we can, what's the major difference first, and how would you say we can bridge this gap?
If I've identified challenges, so to bridge the gap would be to solve those challenges. Our people need to be educated. Our people need to be risen out of poverty. Our people need to have opportunities to become what they've been destined to become. And there's no two-way. That's the responsibility of government.
Okay.
Government is not going to give me oxygen. Government is not going to put food really on my table, but it needs to create the environment for me to be able to live a healthy life and create wealth and pass on that wealth to my people. So how have I dealt with those challenges? Is probably my own way of answering that question, because I can see clearly that the answer to that question is not something I can provide. All
right, before you give us the answer to that question, let's go on a quick break. But when we come back, we'll carry on this conversation with Dr. Olaleye. We'll be right back. Welcome back. So, Dr. Olaleye, before we went on that break, you were going to tell us the way you have been able to solve the problem from your own little corner, right? Sure. Okay,
so before I left England, I was quite strategic in what I was coming to do. A lot of us diaspora returnees should do this, really. Nigerians' problems are multi-layered, multi-segmented, and multivarious. As in, basically, if you divide into many segments, so multivariance is the word that you actually use there, and therefore you could get lost in trying to find your way through those problems. So what I did was to look for a particular healthcare challenge that we have in our country, that I, through my experience in the UK, had seen their solutions had improved the outcomes. So let me put it this way. So working the NHS, a young woman like you will get a letter from a GP, a general practitioner, inviting her for a regular pap smear that happens every 2 to 3, 4, 5 years. So depending on the issues the woman gets and her age, she gets a letter from a GP, and that happens every, let's say, 3 years, every 3 years. You get your letter, you open it. Oh, my doctor has just invited me for a pap smear. Okay. You call the doctor's office and say, I'm so, I'm coming for my pap smear test. And the receptionist on the day, and okay, that's good. Come on Monday, 10 a.m. You go in to do your pap smear at 10 a.m. Monday, you go home, forgetting about it. this nurse that's taking that smear will send it to a laboratory. They will look into that smear and they will confirm that something is going on in that woman's cervix. So she needs attention urgently. So they will send her a letter and say, your pap smear report is back. You need to go to hospital and get somebody to look at it. Remember, this woman didn't have any symptom. Somebody thought about her because her name is already on a database attached to a phone number, an address, and her age. So this woman will come into hospital. She will see a doctor like me. I used to work in the general hospital sort of level at Kent back then. And I would say, oh, your GP sent us a letter and a report about your pap smear. Could you please let me examine you and confirm?
So there is a database and there is a process.
Yes.
Okay.
So I will therefore identify the problem for that woman and stop her from dying from a disease. Now, if you've been listening to this process we're describing, that disease is called cervical cancer. And to put this into perspective, you're a woman listening to this show, just ask yourself, has anybody written you a letter inviting you to come for a test that will prevent cervical cancer? The answer is probably no.
Okay, let's try to break down pap smear, what it is, because I mean, I've seen it over and over again and I understand what it is, but there are people who don't understand it and they feel it's another big grammar, even though the letters and the words are not so much, but it's alien, right? So if you're going to break down cervical cancer and then the test called pap smear, how would you break it down to a layman?
I will certainly do that.
Okay.
And that's why I'm building a scenario for somebody at home to feel connected to that process. So if a man watching can connect his wife to it, if it's him or if the women around him, as a woman, just follow through this.
Okay.
So this pap smear test actually stands for Paponicolos test, not pap that we hit. So it's pap is shortened of a Greek doctor's name who discovered that test. And it's to prevent cervical cancer as a way, which is a public health challenge all over the world. Because cervical cancer is caused by a virus that has been traced to sexual exposure. So a virgin, for example, can never have cervical cancer. The name of that virus is HPV, human papilloma virus.
So how does it form?
Human papilloma virus is picked up from adolescent, from childhood, through sexual encounters young boys have to when they become young men.
So it's from the male folks?
So men pick it up like that, and then they pass it on to women during sexual, and then women share it through many sexual experiences they share. And of course, men too, being greatly sexually active they will take one HPV from one woman, infect other women along the sexual chain. So it's the commonest sexually transmitted virus. 80% of women will be infected in their lifetime. So if you have 10 women listening to this show right now, 8 of you are already infected. Sorry.
Already or will be?
Already. 50% of women are.
So you're saying this is a virus that can be very silent without you knowing it is there?
It's asymptomatic.
So how long does it take to start showing?
I will get there. It won't even show.
Okay.
A woman will not have symptoms. Which is why, therefore, when Paponicolos discovered that years prior to when a woman will be given a diagnosis, if you can regularly smear her cervix will be waving a little red flag for the doctors to pick it up, which therefore is the reason why you do pap smear. And because women form the bedrock of any decent society, women are the future that you must protect. Other countries recognize the importance of this test, so they invest. In the UK, there are 4 countries that make up the United Kingdom: England, Scotland, Ireland, and Wales. They dedicate £1 billion, not million, £1 billion sterling for these 4 countries each. So making a total budget for the United Kingdom cancer screening service, $4 billion annually. And that's how they spend that money. Making sure a woman like you, if you're a UK citizen, gets a letter to prevent you from dying from a disease that eventually could catch up with you 10, 15 years down the line. So that answers the question: how long does it take between when a woman becomes sexually active to when she could have cervical cancer? It's 10 to 15 years. And therefore, coming back to our developing country, we would never get around to sending letters to women. Doctors don't even offer this test routinely. Women don't know. They are blissfully ignorant about a virus that somebody who came to them saying, I love you, had passed on to them, and remaining in their body and their system that can cause cancer. Therefore, I needed to look at that challenge and said, how can I solve this problem? Using science, using management, and of course, using the extra gift that the Lord had imbued me with. And how did I overcome that? The first thing I tried to do was to raise awareness. People need to know. And thankfully, on a day like this, on one-on-one program with you, being my lovely host, and on Plus TV, we are reaching some women, because this is something some people are hearing for the first time.
So, for example, you're tested and it's positive. What is the treatment process like?
Of course, it can be prevented. Without me going too clinical, if you identify an abnormality on a woman's cervix through either the pap smear or colposcopy, you take a biopsy of that area to know the stage. Because it goes through stages of the disease, and you can freeze, you can cut it out, you can remove the entire womb for that woman. So there are 3 steps you can take, and those 3 steps will be determined by the age of the woman, her parity, meaning how many children she's had, and a desire to continue having more children, and of course the stage of the disease itself, and of course also financial consideration. So, and that brings me to, before maybe we go away on another break, the financial implication of this to the individual woman.
Okay, before you go on the financial implication, let's go on a quick break, but we'll come back to this conversation. Welcome back. So before we went on that very quick break, you were talking about the challenges as regards funding. So what is the situation right now? Because regardless of whatever we say, to build the kind of structure and the healthcare system we want, it requires funding. So
absolutely.
How are you managing that for your own solution?
Yes, the solution we designed for reaching the average Nigerian woman out there to, one, know about the need to do cervical cancer screening.
As awareness?
So there's funding
for
needed
awareness.
for that. Then the woman to come physically to a location to get screened, we need to physically put those centers close to those women. So we'll talk about the financial, how we solve those financial challenges. And more importantly, when a woman is told, Madam, there's something wrong with you, you need XYZ number of naira or thousands of naira to fix the problem. 65% of Nigerians live out of pocket, below the poverty line, and the out of pocket expenditure for their health is totally not available for them. So therefore you have that problem, because you've told this woman now she has a problem she needs to solve, she can't afford to solve it. So solving that problem meant understanding the sort of terrain in Nigeria before I came to Nigeria. So I came up with a solution, basically to set up 2 separate organizations. One, Optimal Cancer Care Foundation, and one, Optimal Healthcare Limited. It's a for-profit organization run as a limited liability company. And Optimal Cancer Care Foundation set up as an NGO that receives donation and, of course, delivers humanitarian services. So services that cannot be paid for by patients will be paid for by the organization, by the foundation, and the foundation can get money or donations for that. And that's how we solve the problem of printing colorful leaflets, finding time to organize awareness messages, awareness walks, getting partners and sponsors to support that Go Pink. Go Pink was an example of that platform that was created in October for women to wear pink, identify with pink being the color of breast cancer awareness, and getting people to fund it. So that's that. Being able to run 2 organizations at the same time also meant you have to understand the peculiarities, the pros and cons, and of course how to leverage the advantage of one over the other. So the for-profit organization therefore allows us to be able to convince investors when the time comes to say, how can we be part of what you're doing? We don't want to be doing charity, we want returns on our money. So the for-profit organization can allow us to approach such investors and say, for your 10 million naira, we can put a center in Oshodi, bringing the service closer to women. And the women who come to Oshodi can rely on the Optimal Cancer Foundation to create access for them to come for screening, because the foundation offers free screening every Friday for women.
So for investing in the healthcare sector, how lucrative can this investment be?
It is any investment in Nigeria. A population of 200 plus million is bound to be profitable. I've always said it to anybody who wants to listen. That's why everybody is doing whatever can make them money, because the population size is huge. So it's profitable. If anybody's out there wants to invest 10 million, I can tell you, you get better than putting that money in a fixed deposit account.
Really?
Yes.
Okay.
Multiples of it. And that's part of the problem. Investors are ignorant that if they put their 10 million, they can get actually 4 million on top of it, which is 40% at the end of that year.
I mean, you've mentioned ignorance a lot, because I know before we went on the break, you talked about ignorance being one of our major problems. So it's looking like it's cutting across board from the people you think are educated and the ones that are uneducated. So how do we solve this ignorance problem?
Okay, we're solving it.
Okay.
Keep raising awareness, using all the platforms available. I use social media a lot because traditional promotional methods are very expensive, and we thank God for an opportunity like this to be on Plus TV. Again, we are reaching people, so I use social media a lot. My foundation has a social media page through Optimal Cancer Foundation. I am Dr. Femi, so people reach me a lot through that platform. And of course, we're in the sight and sound generation. Everybody's got a mobile device and they're pressing and pinging and doing stuff, so they can get the opportunity to get the information. So that's one. But the service we offer that we push a lot is the free cancer screening. Every woman gets the opportunity to get their breast and their cervix examined.
For free?
For free.
How often do you
Every
run
2
this?
to 3 years. So that's how we solve the problem of having to write a letter for women waiting to get a letter from their GP and know where to go. But the problem there is that we have only one center. If we have only one center, we can only see a certain number of women a day. But we have multiple centers, so we can see many women across those centers. And our vision and our plan is to put a center in every division of Lagos. Lagos has 5 divisions, as you know: Lagos Island, Lagos Mainland, Ikorodu, Ekpe, and Badagry. So we are in Lagos Mainland, we are in Ikorodu now. We want to come to Lagos Island, we want to go to Badagry, and we want to go to Ekpe. And these 5 divisions will form the hubs for which other branches can go, because everywhere you go, there's a woman.
So in doing all this, have you been able to partner with any side of the government, from the local to the states and even the federal?
It's difficult to partner with government in a project like this.
Okay, why?
Because one, government has to be able to fund it. And if it's not being put in what I call appropriated in their budgets, government cannot release the funding for it. And government can fund it in many ways, and not to just partner. They can actually do this in their own local government health centers. So the partnership I'm looking for is for them to say, come and train staff and come and support the provision of resources. As you know, medical training is not just what you've learned in school. You know, continuous education programs, CMEs, can be delivered around these programs. And of course, government can draw a policy around this. Because if there's no policy, then there can be funding. And if there's no policy, no funding, the people won't get the services. So it's difficult to partner with government, but really my focus is to partner with other non-governmental organizations, corporate organizations who want to fulfill their corporate social responsibilities. They can start with making sure members of their staff get screened. And that is what we've been doing. We've been partnering with great big organizations. They've been very good at saying, you know what, we like what you're doing, come start with us, screen all our members of staff. They pay for their members of staff, they don't get free. And then, of course, they would surely support what we're doing for the women who can afford to come. In other cases, when we now find women who can't afford their treatment, we use our NGO platform to reach out. Just last week, a young girl came with, 11-year-old girl came with a breast lump that she could obviously afford to pay for, because our aunt, who looked after her mom died, quite not as financially buoyant to take care of it. And then we just reached out on our social media, and we got about 7 people who donated sums from 10,000, 5,000. Before that weekend ran out, we were able to raise just about half the money needed. And of course, I happen to be the surgeon to do the operation. I used my position as a surgeon to clear the bill, and the girl was admitted, and we removed the lump. She's home safely. So how do we transfer that into a bigger scale? That's just a classic example of that girl benefiting from a structure. But how do we do that on a bigger scale? The woman in Abeokuta, the other woman in Ado-Ekiti, the woman in Ughelli in somewhere in the east, and that man that has a daughter with a breast lump in Katsina. How do you reach those people? Government is the best opportunity. Government has the best opportunity to do this for our people, and I'll keep saying that is the way for us to go, to get our women out of this scourge of cancer.
All right, so very quickly before I let you go, how would you describe the attitude of Nigerians towards maintaining their own health, very quickly?
Yes, it's still shocking and appalling. People have offered and transferred their responsibility of their health to their spiritual beliefs. So if you're a churchgoer and you just go, it's not my portion, you think that's enough, and that's not, sadly, enough.
Okay.
You believe that by praying, which is good, tithing and paying your tithes and paying your offerings is enough? No. Even the Bible says we should watch and pray. That means watch yourself, watch around you, and we're not doing enough. And that's the major reason. We over spiritualize everything. I think we should be paying more attention to our health. If you believe God, even is desire above all things we prosper and be in good health, even as our soul prosper. That's what the good book says. And I always use that opportunity to tell people, then, therefore, as you are working to prosper, work on your health as well.
All right, so let's pay attention to our health.
Absolutely.
Thank you so much, Dr. Olaleye, for your time.
Thank you for having me.
I've been chatting with a solution-minded and vision-driven change agent, Dr. Olaleye. He's the medical director at Optimal Cancer Foundation. My name is Elsie Godwin. Thank you for watching.